This is Dr. Ravi, and you know me by the name of Wise Dentist. So today, this is episode 2, Aesthetic Dentistry Talk, with me, Dr. Ravi, and we have our guest, Dr. Sufyan, with us. So let people join in, and then we'll talk something about aesthetic dentistry. We are going to discuss a case, and let people join in. So we have Yugma, we have Srishti, Dr. Rahul has joined us. Anjali, Harshvardhan. All right. Okay. So guys, what we are going to do is in upcoming 20-30 minutes, we'll be talking about aesthetic dentistry, the importance of aesthetic dentistry. And then, as I said, we are going to discuss a case. The picture of the case is in my story. And I'll be calling Dr. Sufyan. So aesthetic, as we all know, aesthetic dentistry is really gripping up the dental fraternity. Doing aesthetic dentistry is really getting fruitful day by day. We have n number of benefits. अगर आप aesthetic dentistry कर रहे हो तो you might be aware of all the good part that aesthetic dentistry gifts you with. So, meantime, can somebody tell me what are the positives of aesthetic dentistry? Hello, Dr. Sufyan. Welcome.
Hello, hi, good evening. Hello,
Very good
everyone.
evening. So, how was your day?
Am I audible?
Yes, you're audible, crisp and
Yeah.
clear.
Thank you. How are you, doc?
Absolutely fine. So,
Yeah.
I just started the session by saying that aesthetic dentistry is really gripping the fraternity, the dental fraternity, and I think, as we spoke in previous episode, that
Yes,
this is going to be, and in fact, this is the hot chocolate field in dentistry, and
exactly.
it has various plus points. Like whenever you do an aesthetic dentistry, you see that instant gratification in patient's face. The results
Yeah, that's
are
true.
quite visible. Yes.
Patient acceptance is more, and patient appreciates the work you have done because that's the thing patient will be seeing.
The marketing part also takes place in this. Like if you do a nice case which is very appreciable,
Yes,
definitely your case itself is your one of the biggest marketing tool, and your patient is going to market about you. He's going to be your brand ambassador. So I think aesthetic dentistry has many plus points. Apart from that, like whenever you do a root canal, we are not trying to say that root canal is not an appreciable job, but yes, even if you get that puff, which we
yes,
say,
vital.
the
Yes,
yes, it's quite appreciable among us, among the dental fraternity, but it's very difficult for a patient to appreciate that.
yes,
So,
that's true. That's true.
but aesthetic dentistry, yes, each and everything is quite visible, it's quite appreciable, and the results are very instant. So I think it's very rewarding to opt aesthetic dentistry into your practice.
Yeah. So when we start practicing this aesthetics, initially, if at all you want to start aesthetic dentistry, start with very small cases such as diastema case or a simple case, the one which we had shared in the group. So such case you can start. Although having said that, posterior replacement of amalgam fillings with inlays or partial coverage like onlays, overlays also, that's also aesthetic work. You can start with those also, and then slowly come to the smile designing or complete veneer case or a full mouth rehab kind of case. So all these cases also, initially when you start, the treatment planning involved and the job involved here will be very less, so that you can go step by step, break down each elements of that. And smile designing is such a topic where it includes whole of the face. So smile is something what a patient his personality is there outside. So that is the personality what he shows, and everybody is seeing his smile more. And it's not just smile, it's about the facial aspect as well, facial aspect as well. Sorry, be it a kind of a type of the face, be it oval face or triangular face, or it involves the height of the face, the interpupillary lines, and the upper horizontal vertical height of the face, upper half and the lower half. So all this also comes into consideration. So once we start a full blown case, then all these considerations should be done. And with the smaller cases, when we start this kind of practice, other intraoral factors such as white aesthetics and pink aesthetics, what we see, the gums and the intraoral, are there any overlaps in the teeth or diastema, or there are any crowding, or it can be managed only with the smile designing alone, with the prosthetic work or restoration, or we need to include orthodontics and conservative or endodontic work. All those things will be considered. So once we go on planning these cases, you'll get to know and come across the features and how to go about that. And also, when we start doing the posterior cases, we can include the patient's anterior work as well, just to show few of the cases and tell, yeah, this is the kind of work. Last time you were telling, I couldn't resist showing you one of the work. So such kind of work you can market yourself, or you can just do a mock-up and show this might be your future result when we do. So all these things we can consider and go ahead with the smile designing cases and aesthetic cases. And aesthetic cases, what you said is these are very rewarding and instant gratification. What you said is right. And although the planning involves a little bit of time, but as and when you start doing cases, I think you'll get a hold of it.
How do you see how important is treatment planning? Like choosing a case is very crucial, I'm sure. I mean, irrespective of whether you are a dentist who has just started with aesthetic cases, or you are a master. I've heard that always begin keeping the end into consideration. So how important, how important is treatment planning?
Yeah. See, if the patient walks into a clinic saying, I want this smile designing, then definitely patient is expecting something more. And there are few patients where you advise him, maybe after a root canal or maybe other teeth, maybe when he opens a mouth, give him a mirror and just see the other amalgam restorations are there. When you smile, when you open your mouth, these are the ones which are visible. Would you mind changing it to the teeth color? Many patients think that the amalgam fillings are the strong ones and they are lasting long, maybe 10 years plus, so they will last more longer. So you can tell the ill effects of that. Maybe when you keenly observe, maybe there might be a little fracture line crossing the filling, or there may be a micro leakage there. And when you take an X-ray and show the patient, maybe there might be a secondary caries below that, and patient might not be symptomatic. So all these such cases we can start. Tell them although we can go ahead with the composite also, but when imagine a premolar which has a amalgam filling, when you tell the patient to do this work. Imagine a case where canine root canal is treated, and premolar you have amalgam restoration. When you're giving a crown on canine, so you might as well advise the patient to go ahead with inlay or onlay or partial coverage for the premolar. Maybe it was a little bit crowding is there or a little bit tilted is there. So you can get this kind of results. So when you motivate these kind of cases are the ones which you start, and then slowly come to a bigger cases. And case selection is very important in these situations.
I think motivating a patient, and as you said, just educating a patient will really solve a 50% of the problem when you start doing aesthetic dentistry. Like I remember a patient who came to me and he just said, Doc, I got this premolar in my smile line. Like whenever I smile, My
Hmm.
premolars, they are visible, and there is
Yes.
a silver amalgam filling done, which is
Yes.
reflecting. And many of
Correct.
them have complained that is there a decay or the tooth is discolored. And every time I keep my mouth open and I show it that it's not a decay, it's an
Yes.
amalgam restoration.
Yes.
So,
Yes.
you know, he gets very conscious. And this was a very,
Correct.
very small issue, but he was facing this very regularly until and unless I pointed this out. He came for a root canal for some other tooth, and I said,
Mhm.
Ki, doesn't this tooth bothers you? And that's where the whole story popped up. And he ended
Yes.
up going for a crown for that tooth. So I think you need to educate the patient, as you rightly say. What do you say?
Yeah, once you tell the patient, this is the patient might have not been noticing this. He might be thinking this is a natural thing and this is there in his mouth since many years and this cannot be changed. Maybe this is how it is. So when you give options and tell the treatment outcome, this might be. So the first thing he goes back home and every day he keeps looking at the same thing. So that's how the patient will come back and motivate. It's not that we are doing something different. It's like we are motivating him and telling him there might be a little more advanced treatment which we can be done and last longer. So yeah, these kind of cases are the ones which we can start.
And I would like to add a few more things like whenever a budding dentist who just gradually starts doing aesthetic cases, it's
Yes,
very important for that budding dentist to do mock-ups. Mock-ups are
correct.
really helpful when you are just beginning an aesthetic, whenever you are trying to incorporate aesthetic dentistry into your routine dental work. Do a
Yes,
mock-up, click few pictures, and send those pictures to your patient. And I'm pretty sure that your patient would be seeing this n number of times and
yeah.
they would be prepared. Also, now see, I documented the patient's picture of before and after the case which I was talking about. And then
Mm-hmm.
happened to be I showed this same case to my next patient who
Mm.
had this amalgam feeling in his posterior teeth. And I
Okay.
narrated the story. And the patient turned up like, I don't want an amalgam restoration. Can you do something? So that's how you go. You should be a good storyteller as well. So
Yes.
I think the important tip over here is start doing mock-ups, start
Correct.
taking pictures, documentation,
Mhm.
and then
Yeah.
start marketing your cases. You know,
Correct.
and this will gradually turn up into something pretty good and
Yeah,
pretty
this is the other
big.
other way of seeing aesthetic dentistry. I started work without knowing all this. The tips which you are telling now, marketing and all those, I just wait for the patient to come and tell that, okay, I want the smile designing to be done. I want this to be done. So then again, I notice in my practice there are hardly out of 10 or 10 page, maybe 3 or 4, or maybe hardly 3 come for this complete change or makeover. There are more patients, almost 65-70% of the patients we need to tell them and point out all those things. So this
Exactly.
is what you are good at. I know that the marketing and the tips and the way how you convince the patient for the
It's
treatment.
very
Yes,
important.
yes, very much important. The storytelling what you told is very much important. After we had discussed last time and before also, I also started doing storytelling kind of conversation, having a conversation with the patient.
And that's what, like, as I said, I have integrated storytelling into our upcoming workshop. So all the viewers
Yes.
watching us, me and Dr. Sufyan is going to come all the way from Kuwait, and there was a huge rush of people who were demanding aesthetic workshop, aesthetic conclave, and me and Dr. Sufyan, we are coming up with this aesthetic conclave, which is on 21st and 22nd of May in Mumbai. So coming back to our topic, uh,
Yes.
we have incorporated these things into our workshop. See what happens once you are unaware of the aesthetic part. You know, once you are not aware of how do you go, once you're not aware of the marketing part, it's very,
Yes.
very, very difficult. Your learning curves become very big, you know, and it will take a lot of time. You will struggle doing aesthetic dentistry. And what is the reward which I see into aesthetic dentistry is it is one of the best marketing tool, one of the best marketing tool. Like
Yeah.
many a times, you know, patient. they do not need to tell about your work. The person who is like I treated a case. I remember the patient's name was Rajesh, and
Mm.
there was a simple small notch on his teeth, and he was carrying that notch since 12 years until he got to see a before and after picture in my clinic. So there is a
Mm.
television which is always running a few before and after cases along with the
Yes, this was
storytelling in my
yes,
clinic. So happened to be when he was sitting at a reception, he saw this picture and said, "Doc, are you sure that I can get this thing treated?" And I said, "Within few minutes, I will gift you. I will correct this." And I immediately did a mock-up and I sent a picture, and he was shocked. And he said, "Doc, I want to get this thing done right away, right away."
yes,
So
yes,
and then when I repaired, his friends, the friends whom he used to see on a daily basis, I mean, there were a number of people who came up to me for n number of different problems, different
it's
dental
not just a
problems,
smile and
other
that.
than
Yes,
yes, the dental part.
yes,
So happened to be this was my marketing tool. Everybody started asking him about कि किधर से कराया, कौन है आपका dentist, and how good was he, and my patient
yes,
started narrating good things about me and my clinic. So
correct.
I see aesthetic dentistry as one of the best marketing tool for your clinic.
Yes, and also the aesthetic dentistry is all about materials nowadays. We are
Yes.
getting into, say, imagine a case of two central incisor or a central or a lateral. You go for root canal, one and one two root canal. You go ahead. So then what you do? Root canal you do a crown and send the patient. No. So when you do a root canal, shade matching for the crown for the adjacent will be very difficult. We have come
Hmm.
to a point where okay, this is the maximum which I can get. No, when we start convincing the patient, okay, you get these two crowns, other two go ahead with the veneers. Okay, so or else maybe you can just give a option of full mouth from maybe canine to canine or premolar to premolar. So that's how from two teeth crowns you have gone to a complete set of aesthetic crowns or aesthetic partial coverage or a combination of partial coverage and a full coverage. So not just doing crowns and finishing the case, we have to go in a way of veneers, laminate veneers, inlays, onlays, overlays, and nowadays materials are so many materials and so fantastic materials which can we can match the shade so perfectly. So all
But
these
I think,
materials
but
and
I think one should have a very good knowledge of materials.
yes,
Since we are blessed with a number of materials, having a good knowledge, and this could be through a good mentor, I believe. You cannot
and
ask about one material from one dentist and another material from another dentist. You need to have good mentorship. Yeah, please
yeah,
carry on.
what you mentioned. Okay, 1112 crown, PFM
Hmm.
or zirconia crown and send it. So it's the lab person who is deciding which crown they have to do and send you. You are not dictating them which kind of crown or which kind of material to be used. Maybe a patient with there's a combination case and he does a Emax crown with a high translucency and send you. He has not seen you. He has not seen the discoloration on the tooth. Obviously, when you use a high translucency material from the Emax, so the shade will be seen out. And no matter how much good cement you use, opaque cement you use, there will be a little bit of marginal hue will be present. So all such things we need to take photographs, communicate with the lab, tell them we need this kind of material and this is the what the patient is needing and I'm looking for this kind of result. And you coordinate with the lab technician, send him photographs, let him coordinate with you, doctor, this is the thing. You ask him for the trial, try in the patient's mouth, the photographs, send it back again, discuss with him, see these line angles are not good, that surface texture is not good, maybe we need a little more improvement in this one, shade
Agreed.
matching is not good, and all those things. Having said, although we use a perfect material from the lab, then again when it comes from the cementation, we have different kind of material, light cure, dual cure, and then resin based material. When it's a combination case of a crown and a veneer, we need to be very sure which kind of material you are, which kind of cement you are using. Maybe if a zirconia core is there, you can't use a light cure material. And if it's a very dark core is there, you can't use a translucent cement because just because it is lying in our clinic, we can't just give it. So knowing the cementation part is also very important, and we need to be, as you said, keeping the end in the mind. We have to start. So once we start doing the case, which kind of material will be, what is the type of treatment, what is the type of material we'll be using, and what is the kind of cementation. In between comes the temporization. Temporization is just like a test drive. You go want to buy a car, you go and do a test drive for all the, so you can mix and match of all those things. Maybe you give one shade temporary veneers, and then let the patient use it for 3 or 4 days. He'll get a reviews from the family and friends. Maybe he wants a little more darker, maybe lighter ones. So again he comes back to change the temporary. So once he get satisfied, you can tell the same shade to the lab and get this. So all these components are the ones which comes into smile designing, and these are the ones we are discussing in the upcoming workshop. So I think it's a conclave. It's the name says as a conclave because we have been mixing the aesthetic dentistry into practice management. Dr. Ravi will be speaking on, and marketing tips and finance, and I'll be speaking on all the clinical side of it. So we'll go ahead with the case discussion.
Yes, I think we should start discussing case, and let us summarize like whatever we've talked till now. Test drive is very important. Doing a test drive and starting off with small cases is really going to be a game changer in aesthetic dentistry. Having a sound knowledge of materials is very, very, very important. You should start keeping the end into consideration. And yes, you cannot underestimate your communication with your lab. So you will have to take your lab into consideration. You will have to communicate. You will have to communicate before you start the case. You will have to communicate during the preparation, and definitely, you also need to share your cases once you're done, because the lab technician is the guy
who has person. That's true.
He has done an amazing job, and the equal credit goes to him as well. So Dr. Sufyan, let us start with the case discussion. I think
the patient wanted, the chief complaint was to get his teeth proportionate, because he was complaining two centers are bigger than the laterals, and then from the canine they're all, so whenever he smiles, these two are the ones which are seen, and added to that there is a diastema and flaring of the central incisors. So these are the ones which the patient was concerned of. I had put a poll, and many of the doctors replied. They participated. One of the doctor had said ortho, and then followed by veneers, and then other doctor also has said ortho correction and aesthetic restoration. Intentional root canal for 1-1, 2-1, 2-2, and 1-2, and then go for crowns. Okay, and then one doctor has said only veneers. Another doctor has said canine to canine smile designing after intentional root canal of the anteriors. So these are the ones with the treatment planning. Is the patient came to me for this reason. Then considering the ortho, why was ortho ruled out in this case? Was the first thing was a time factor, and that was a major factor what the patient was looking for, and the patient was 45 plus. So having discussed with my orthodontist, I have a very good orthodontist. So he said it would take a little bit of longer time to get this. And then after correcting with the ortho also, the diastema which is present in between, now after he joins it, the diastema will be, I'll be distributing the space in between the centrals and the laterals. So I'll be giving you a space in between the distal of the 1-1 and 2-1. So in that space we can cover up with this one. So that was also a very conservative plan. Definitely aesthetic dentistry is nothing but conservative. So ortho would be a very good option. Patient compliance and patient acceptance is what we need to do. Then next is intentional root canal with 1-1, 2-1 anterior canine to canine root canals. Yeah, intentional root canal. When we do intentional root canal, when crown preparations or veneer preparations are they are involving the pulp or very close to the pulp, at least 2.5 millimeters if we have the distance from the pulp on. So there is no need of doing an intentional root canal. So I'll just show the case in my screen, on the screen here, because I don't know how to share it with the in the live. Just flip over my camera. Yeah. Yeah, everybody can see this. Can see this?
Yes. Yes.
See what I did. There is an intraoral photograph. Okay, so these are just pulp-ons. So I going digital. I have not too much into a digital. This was just on the patient on the chair. I took a photograph, placed these pulp-ons, the schematic diagrams of those, and then I divided these into. I just drew few lines on this interdental papilla and saw the distribution of the central incisors and lateral incisors. What should be my outcome? So when I went through this one, immediately when I saw, I was also in this notation that I had to do intentional root canal treatment or orthodontic treatment. But when I took a photographs and draw these lines here, and then I saw only this was the distal part was the one which was extra here, maybe around 1.52 millimeters here, and here maybe 1.5 here, and only these are the points where I need to reduce the crown and increase this to the mesial aspect of it. So there was no point me doing root canal here without any reason of, because if it have this line would have been here, little more 1 millimeter to the left or 1 millimeter to the left, right side here in the distal, I would have gone for retention root canal. So this is how I planned, and then this is just a zoom photograph of it. And the treatment done here was veneers, partial coverage without root canal treatment, very minimum preparation. Only all the distal part of centrals are the preparation was more just to get in line. You can see the lateral incisor, okay, maybe 0.8 or 0.5 millimeters of finish line, and I just crossed the contact area, and palatal surface is just like that. I have not touched it, okay, in both laterals and the centrals as well. Palatal maybe wrap around I have given in the centrals, little more the palatal coverage, because seeing this is a case of a deep bite, little more deep bite when the patient is moving the mandible forward, there might be if you do a butt joint design of the veneer, there might be a dislodgement of the veneer. So considering the treatment planning, I went around a palatal wrap around here, and then this was the cementation stage, isolation, nice finish line, exposes finish lines, use a rubber clamp, okay, so that all the excess cement is removed properly. This is the central and the laterals, and this is the immediate post-op cementation. So once I call the patient back after 1 week for let the gum heal and the cementation and everything, the color is not that much. I think you can appreciate the difference here.
Yes,
so what the planning we did was interdental, draw a line here to see how much we need to reduce both the sides. When we reduce this, there is no need of me doing the intentional root canal here. Okay, so canines I have not touched because canines was patient did not want these to be touched. His main concern was this one. Maybe at later stage there are few amalgam restorations, the hue which we were speaking on this too. Maybe he will go ahead with these, motivate himself for doing these kind of these veneers in the back areas. Sorry. Yeah, so treatment planning is very much important. So we saw here how as soon as we see the patient, we think of doing root canals and orthodontic treatment. So smile designing or aesthetic cases is combination of all those things. We need to think of all the possible outcomes, and then go ahead with what is feasible for the patient and yourself. So I'm not telling ortho is a bad option or anything, but the only time factor is the one what patient will be considered. I have many patients who I have sent it back to orthodontist, and they have never come back for my smile designing cases because they're happy with the alignment and they have gone ahead. So yes, aesthetic. See, when we start doing this kind of cases, so patient will be appreciating your work, and you can market your cases this way. and you can show this kind of cases to the next patient and ask them, you can get this kind of work done. So this is just an example of how we can go ahead.
So I would like to compliment. This was such a nice case, and the outcome was really very nice. And
Yes.
I'm very happy, and I'm really glad to share to viewers that I have learned this art from Dr. Sufyan as well. And if you wish to witness the art of, the art of aesthetic and cosmetic dentistry, here we have Dr. Sufyan on 21 and 22 uh, of this month here in Mumbai. So if anybody wishes to join us, feel free, drop us a personal message, and our team will get back to you. So Dr. Sufyan, I think we
Yes.
had a great discussion today,
Yeah.
and
Before we can just touch upon a little bit of financial aspect. How to see? I told you one case with one root canal and two root canal, two crowns. The financial aspect, it will come to only two crowns. When I was discussing how to convert that into a veneer for 2-1 and 2-4 teeth. So when we do this, the financial aspect also will be into consideration. How will you drop the suspense of telling the
right.
patient get two extra and the price?
See, how do I see? I see it that do not disclose your price. Patients they always insist, in knowing the price in their very first consultation. So I
Yes.
try to sort of, postpone their question till we do not attain that mock-up or test drive. Because what
Yes.
happens, until unless they don't see themselves, they do not drive, they do not test that drive, which you're going to
Yes.
give, they do not see that final outcome. They are not that convinced. And
Correct.
that is the exact point where you, as a dentist, need to pitch your finances. And
Yes.
like, how do I see? You will have to create the importance of aesthetic and cosmetic dentistry. Like doing four veneers should not be quoted as charge of a veneer 1 into 4, right?
Okay.
Yes,
Mm.
you will have to add your smile design charges. What at our clinic we have something known as smile design or treatment planning charges, wherein
Mm.
we do take a series of pictures.
Mm.
Uh, we take some impressions, we send it to lab, we receive a mock-up.
Mm.
We try to transfer that in patient's mouth, and then
Yes.
we take few pictures, we make few changes, and again we take few pictures, and then before and after, and then I show it to patient. And the
Mm.
very point where the patient is happy, we talk about
Yes.
finance, you know.
Then.
And yes, that's the point. That's the point where you need to touch upon. And
Yes.
once you start implementing all these things without skipping any of the steps, patient will gradually understand the importance of the treatment planning, and they are ready
Mm.
to pay you for that treatment planning. That
Yeah. The
it
time
takes
you spend on planning
yes.
the case and showing him the outcome. Yes.
Yes, it takes extensive amount of time. Like how do I say कि treatment planning आपको खाली you feel like the doctor is just उनके mind में सब कुछ already feeded है. No, we need to
Mm.
spend some extra
Yes.
time, with our team discussing about your case, and the amount
Yes.
of time which we dedicate,
Yes.
is really appreciable. And I think कि आपको देख के लगता होगा कि आप इसका importance को समझेंगे. And
Mm.
you look from a good reputed background, so I think कि आप एक डॉक्टर के कीमती समय को आप समझेंगे, and you will not deny paying me my charges. So I think
So all these
वहाँ पे आप treatment
one-liners
charges,
will be very helpful.
one-liners are really
Yes.
helpful. At my
Yes.
practice, one-liners are really objection handling in aesthetic
Mm-hmm.
dentistry is very, very, very important.
Okay.
Every time
Mm.
वो हम रामायण में देखते ना, एक बाण चलाते हैं तो दूसरा एक बाण आता है और वो नल्लीफाई हो
So
जाता है.
you have a set of one-liners when to drop the prices. Huh?
Yes, that's very important. That's very important. And what patient sees is your confidence. Patient आपके आंखों में वो confidence देखना चाहता है.
Not be very worried when you drop the
yes,
price. You should be very
yes,
confident.
exactly. And you need to talk about finances very confidently. Patient का birthright है डिस्काउंट मांगना, चीप प्राइस
Yes.
चीप प्राइस वाले डेंटिस्ट से आपको कंपेयर करना, but at the very same time I say it is your birthright to charge your worth, and
Correct.
charge your worth confidently, quote your worth confidently, or else otherwise आप इतना सब see why do people अपने आप को कर्ज क्यों करते हैं? Because आप अपने हार्ड वर्क को you do not appreciate, you yourself do not appreciate. In the initial of practice or the initial of aesthetic practice, you will feel like कि हाँ यार पेशेंट का एक्सेप्टेंस है ना थोड़ा सा कॉम्प्रोमाइज होगा, बट एज
Correct.
एंड व्हेन एक दो पेशेंट रिजेक्ट होंगे, बट थर्ड पेशेंट या फोर्थ पेशेंट या कोई एक पेशेंट कन्वर्ट होगा ना, वो तीन का
Mm.
फेलियर यूल फॉरगेट,
Yes,
एंड
yes.
एक का सक्सेस एंड
Correct,
मॉनिटरी टर्म्स में
agree.
जो आपका गेन होगा वुड बी अ
Correct.
बिग विक्ट्री, एंड दैट वुड
Correct.
बी एन आइस बैरियर, और वहां से आपकी जर्नी स्टार्ट होगी. So, in order to get one good case, you will have to reject few 3 to 4 bad cases as well. So you
Mm-hmm.
will have to understand that aesthetic treatment was the need, or the was it a want? पेशेंट का नीड था या वांट था, और आपको
Yes.
कैसे उनके वांट में उसको कन्वर्ट करना है, उनके इमोशंस को टच करके, ये सब हम आपको वर्कशॉप में ही बता सकते हैं. वी कैन नॉट
Yes.
टेल
No,
यू
it's a very long topic,
anything.
and go
Yes,
on talking. It's a very
exactly, exactly.
vast
And I
one
think
to
I
discuss.
think many of my friends, my juniors as well as my senior friends, when we, जैसे हम Dr. Sufyan के साथ we are doing a friendly conversation, uh, we discuss these things, and I find कि
Yes.
finance, money is one of the biggest motivating factor in dentistry. you know
Yeah.
अगर आप एक अच्छा केस करते हो and you earn a good handsome amount of money, you will be really motivated in doing some another aesthetic case. So
Correct.
understanding how to charge confidently, how to handle price objection, and how to quote your patient for your aesthetic treatment. So
Mm.
डॉक्टर माइकर के पास और बहुत सारे ऐसे सक्सेसफुल डेंटिस्ट के पास से मैंने ये सीखा कि काम आपको आ जाएगा, यू लर्न द वर्क,
Correct.
बट आपको कोट करना आना चाहिए, आपको चार्ज करना आना चाहिए, आपको ऑब्जेक्शन हैंडलिंग आना चाहिए, एंड जिस दिन आप प्रॉफिट बनाने लगोगे ना, वो आप चाहे जो भी फील्ड में बनाओ, आपको मजा आने लगेगा. सो एस्थेटिक डेंटिस्ट्री इज
Mm.
वन फील्ड आई फील लाइक वो आपके लिए मार्केटिंग का भी काम करेगा, आपके लिए प्रॉफिट मेकिंग का
Mm.
भी चार्ज करेगा, काम करेगा. सो हियर
Correct.
वी वेलकम ईच एंड एवरीबडी, इधर आप लाइव देख रहे हो, रिकॉर्डेड देख रहे हो, हम लोग लाइव के थ्रू विल बी शेयरिंग आवर नॉलेज डेफिनेटली, बट अगर हम 4 से 6 घंटे 8 घंटे बैक टू बैक अगर हम पावर पैक परफॉर्मेंस दे रहे हैं, व्हेन यू आर रेडी टू लर्न, वी आर रेडी टू टीच. सो अगर आपका ये एटीट्यूड है तो कम एंड जॉइन अस. एंड आई थिंक डॉक्टर सुफियान कंक्लूडिंग नोट दे दो एंड यहाँ पे खत्म करते हैं.
Yeah. See, I'd like to say all this to sum up all these things. What you said is very right. We need to learn the art and skill of not just doing the work and handling, but also the financial aspect where marketing. And it is not just in aesthetic cases. The marketing, what you learn, and the way you speak and the skill you learn will be for the other cases and the general practice as well. Whatever the other cases you do. So it's just
Yes.
a learning process, and introduction of this aesthetic practice into your day-to-day routine work is very much rewarding, and you yourself will feel confident and wanting to do more. So just in case you just see a patient, and then you will be like, you will try to find some way to convert this into a aesthetic one. You will do that, trust me. I have gone through all this process, and I whenever the patient has come for the post any kind of treatment, I'll try to convert it into a aesthetic work as much possible, trying new things, new materials, and new lab, and new type of treatment planning, digital word, mix of digital and analog, and all those things. So I think smile designing is just a mixture of science and art and skills, and keeping function into consideration. This is very important. So I think once we start doing, we'll learn a lot, and it's just a learning curve. I think sum up all our live session.
Yes. So I think Dr. Sufyan, we should
Hmm.
conclude this
We'll,
and
we'll,
give.
we'll ask the audience anything they want to add
Yes.
on or speak, or
Yes.
anything to tell. You can just give them 2 or 5 minutes of time,
Yes. If
so
anybody
that they
would
can.
want to join, or if anybody would want to raise any question, so far we'll
Yes,
be more than happy to answer. And
yes.
So as we spoke, Ram Ram Bhaiyo, Rajat sir from Delhi, a very renowned dentist. Ram Ram
Yeah.
sir, Jai Shri Ram.
Hello, sir. Hello, sir.
Yes, he is very, very inspiring and very empowering. I keep on at his cases, and
Yeah.
he is motivating
I got
all
to
the
know him
budding
from you
friends.
only, so
Yes,
hopefully we'll meet someday.
yes, definitely, definitely. So I think there are no questions. We should
Yeah.
conclude this. And yes, guys,
Yeah.
again, we'll see you next week, either on Saturday or Sunday, with one more case discussion with whatever little we know. And we would love to know if you differ on
Yeah.
any of the treatment plan or treatment outcomes. We'll be more
Mm-hmm.
than happy to welcome you. And
Yes.
okay, so somebody has, is there any chance that the conclave could be attended online? We'll try to figure this out for you,
Yes.
Dr. Prabhu, then we'll let you know for sure. All right. So, Dr. Sufyan, shall we conclude for today?
Yes. It's
Chalo,
nice
have a
speaking to you all, and looking forward for the next live session, and looking forward to meet you in person as well.
yes, amazing. Chalo, thank
See
you
you.
so much.
See you.
Have a great
Bye
time. Bye
bye.
bye.
Good day.
Bye.
Good day. Bye.